Live, okay, we're back and we're going to go through H 816 with an item markup on the bill with the new draft that Katie's brought us. And what I'm going to suggest is that if you have an interest in your in the room or you have an interest in the bill, raise your hand. So we can have that conversation. The next time we go through it, we'll all work together. Yes, sir.
There's just one question. I remember OPR had a number of concerns. So assuming they provided some input to you on this latest draft, or have you heard from them?
I have not heard from them on this latest draft. I don't think they've seen it. My directions were not to include OPR's recommendations, and instead there's that new report that asks them to look at the issue of AI and professional regulations.
So, yeah, so it's my understanding, Katie, correct me if I'm wrong, OPR's suggestion was to really expand the professional coverage.
It was to not sort of limit AI regulation to mental health professionals and to look at the issue of AI and misuse and all regulated professionals a little bit more broadly. So this doesn't do that. It keeps but it also removes the section from Title 26 that is specific to mental health professionals and regulating mental health professionals, and instead it's focused on regulating entities that would provide mental health services without a mental health professional providing those services.
And we can have OPR in again if you'd like to do that.
I just wanted to understand
Sure.
role they play.
Seems like we have to take a time to see what they want to do.
I think there's so many professions that and actually some of them don't belong here. Right. So this bill could go on for another 6 or 8 months.
Okay, so your first section is your purpose section. In previous versions, you had language that was also about, regulating mental health professionals and talking about the administrative support that mental health professionals could use. That type of language is no longer in the bill. Instead, your purpose is focused on preventing psychological harm, including death by suicide, by ensuring that mental health services are delivered by mental health professionals and not independently by AI systems. Then you have the section 2 on professional conduct.
So let's go slowly because if there are any questions or comments about the language, we should hear them. So, looking across the room. Okay.
Okay. Next, you have section 2. This remains unchanged from the House. This gives a list in Title 3 of all different types of behaviors that constitute unprofessional conduct. And being added to that list at the top of page 2 is for mental health professionals and misuse of AI.
And that's the new section below.
And then in section 3, this is a section in Title 18. This has prohibited uses of artificial intelligence. So first we have our definitions. Section 1 is artificial intelligence, means an engineered or machine-based system that varies in its level of autonomy and that can, for explicit or implicit objectives, infer from the input it receives how to generate outputs that can influence physical or virtual environments. The House version also contained a sentence along the lines of that this would include generative AI and then a definition of generative AI. That has been removed from this draft.
Can you remind me?
Oh, sorry, can I remind you why?
Sure.
I was asked to remove it, but the sort of concern that House Healthcare received right as it came over, or right as they voted it out. And that they're hoping that there'd be more work done on it, is that, House Commerce told them that that sentence, the AI includes generative AI as circular, but House Healthcare really wanted to include a definition of generative AI. And the only way to do it, because it wasn't used anywhere else in the bill, was sort of referencing it, so that, I don't know, that was the issue with the language.
So we're probably just leaving it out for that one.
And these 2 and 3 have to be swapped, they're alphabetically out of order. So they're numbered correctly, but they're not. So I'm gonna swap those.
Oh.
Do you see A 2 and 3? The numbers are out of
Oh,
order. Yeah, I just noticed that.
So we had number 22 between two other very strange numbers on 57 and 58 and appropriations yesterday, so this is just. So go ahead.
This might have a generate outputs that can influence physical or virtual environments. I understand the virtual environments has AI change physical.
I'm not your person to answer this. I'm sorry.
No. I didn't know if you remember hearing testimony.
I remember that the recommendation of House Commerce was to pull language from California, in terms of AI, so I believe this definition came from AI. We have an attorney who works with House Commerce who spends a lot more time on AI issues, so
That's fine. I just didn't understand this one.
I'm wondering if you could give you
Sure.
a better answer than
I will
that.
talk to Representative Margot.
Who is that? Who's the attorney? Maybe we could get-
Right. Ray Siegel.
Oh, maybe we could just get his comment on that.
Yeah. Hate to volunteer him, but he might have a better sense
We
than
you
I
think
do.
it's best to have him come in. I know, this is the problem. Is it
Or I
better-
could write him an email just confirming that this language came from California
Okay.
and asking how AI can influence the physical environment.
Well, I mean, a physical environment is a body. It's a human body, right? I mean, lighting.
Yeah,
Physical environment.
you're seeing the virtual.
Yeah,
Law of the physical. Yeah, fine. I don't,
let's find out about that.
but I'm sure you're right.
It is California.
Of course, yeah.
I will reach out to
No,
him.
that's the first thing. We care about shaking. Yeah, I didn't know.
They're staying with this number, but yeah.
Gotcha.
So I'll just go in order for now. So mental health services means counseling, therapy, or psychotherapy services used to diagnose or treat an individual's mental or behavioral health or provide ongoing recovery support, including, these are examples, providing therapeutic decisions, issuing direct therapeutic communications, generating treatment plans or recommendations, or detecting or interpreting emotion or mental states. So those are all mental health services, which is important because that subsection B says you can't provide mental health services. For AI, can't provide mental health services. Then we have our definition of mental health professional. So it's a person licensed, certified, or rostered, who is a physician, an APRN specializing in psychiatric mental health, a psychologist, a peer support provider or peer recovery support specialist, social worker, an alcohol and drug abuse counselor, clinical mental health counselor, a marriage and family therapist, a psychoanalyst, an applied behavior analyst, or a non-licensed or non-certified psychotherapist, or a non-certified psychoanalyst, or any other professional who provides mental health services. So it's very broad.
maybe ask a question, and I'm always one step behind it seems, but if you, if you look at page, so the page 2 where we just were, line. Well, I guess lines 14 to 15. When it talks about prohibition on generating a treatment plan, if that's not gonna bump up against the recording of a session that then gets transcribed into notes and, because I mean, that's, you just have that in another bill. I just wanna make sure that that's not
Generating a treatment plan.
in conflict with the,
I would read generating a treatment plan to sort of be the comprehensive, plan for treatment. Sort of the comprehensive
I mean, I
manner,
but I just
um,
to make sure. I don't know,
You
Jess,
should-
I
you
bet
should-
you could say on that.
So is your concern on the issuing direct therapeutic communication?
Generating treatment plans, because if your appointment is recorded and then that AI recording generates notes.
Yeah.
Is part of the
Then
note.
you can't have those notes go to the page without.
Alright, that's what I wanna make sure that that's
Without
different.
the
Okay.
interface.
The human has to take the notes and turn it into.
It's just.
If you let AI take the notes and turn them into.
Right, that's the problem.
Right,
Yeah,
That's not,
okay.
one thing we might
point.
think about. The people most likely to use AI. We're setting up a youth mental health care tiers for it. The ones most likely to go to the chat box and say, so-and-so said this and thinks that, and what do you think is your problem? And that's just something we can.
So whenever we're writing a bill about peer support counseling, then somehow it's going to have to link in with this question. Looking at my boy.
you can add AI in your bill.
Check.
Okay. So did you get what you needed on this treatment plan?
I guess so, as long as,
Jessica Barnard, Vermont Medical Society. I think the main point, I think those services would all still be allowable because what the main sort of prohibition is providing services without the involvement of a mental health professional. So as long as the mental health professional is reviewing and signing those as their notes or their treatment plan, that you could use it to support that work, but not do the work entirely for you. So I think that's, you're gonna get to that on page 4, which is the how you can't use it.
thank you, that's helpful.
I think we don't want to feature fear, but kind of the professionals use what AI and.
Right, exactly.
Yeah.
So we went through the definition of mental health professional. One of the examples of a type of mental health service. That would require involvement of mental health professional is therapeutic communications. We have a definition of that. It means written, verbal, or non-verbal interaction intended to diagnose or treat any type of mental or behavioral health concern. Provide ongoing recovery support or provide any advice related to diagnosis, treatment, or recovery, such as engaging in direct interactions with clients or patients for the purpose of understanding or reflecting the client or patient's thoughts, providing guidance, therapeutic strategies or interventions designed to achieve mental health outcomes, offering emotional support, reassurance, or empathy in response to emotional or psychological distress, collaborating with a patient or client to develop or modify treatment plans as for therapeutic goals, and delivering feedback intended to promote growth or address mental health outcomes. And you have a definition of therapeutic decision. Again, therapeutic decision
let's just go back to that. Only the blue yellow section. Before we go. Are there any questions there? Okay. Good.
Okay.
And I'm including the salary. Perfect. All right.
So next is the therapeutic decision. The therapeutic decision was an example of a mental health service. It would require mental health professional involvement. So that's defined to mean a final clinical determination regarding diagnosis or the selection, modification, or termination of treatment or care. Therapeutic decision does not include algorithmic risk scoring, data analytics, or other clinical decision support tools when used under the supervision of a licensed mental health professional.
There it is.
I'm sort of wondering out loud if the second sentence is needed in this new version because it's saying that it doesn't include this risk scoring or data analytics when supervised or authorized by a mental health professional. But we're saying that all therapeutic decisions have to happen with the involvement of a mental health professional.
So, yeah, that's a good question. Why would those be identified separately? Support tools.
I mean, if you wanted to allow algorithmic scoring and data analytics without a mental health professional weighing in, then you would sort of end the sentence there. Therapeutic decisions does not include algorithmic scoring or data analytics, period. But by having this sentence, you're sort of saying it doesn't include, therapeutic decision doesn't include these things so long as they're provided, they're under the supervision of a mental health professional, but already a therapeutic decision has to be under a mental health professional. Am I making sense?
Yeah, Jessica Barnard with the Medical Society. I agree with Katie. I think the second sentence actually really complicates
It
what we're
does.
trying to define or not
Oh.
define and what does or does not require supervision.
Yeah.
I don't even, well, I'll just add to that as we're looking at this definition. I'm not even honestly sure if this definition is needed with the expansion of the therapeutic communication definition. Because that therapeutic communication includes written or verbal interactions intending to diagnose or treat. So to me, that actually encompasses therapeutic decisions, but I certainly think the second part of that definition, therapeutic decisions, is confusing. So either way,
I'm fine with taking it out. I mean, somebody.
All right, pick that. No problem, thing out. Then the question becomes, do you take out a mental health services a reference to
Well,
it?
we just took out that one sentence. We didn't take out therapy.
Oh,
Therapeutic
I wasn't
decision.
clear.
Why would we take out therapeutic decision?
Feels out to make out for the NASW, come on. That's totally up to you. When we were working on our draft, we used the word decision, but didn't feel that it needed to be defined. But if you feel that it would be appropriate to define it, just the first section, sentence of number 5 would be.
Yeah,
First sentence.
because sometimes those decisions have legal standing. But it's important.
Okay, so what I've heard is to retain the first sentence in subdivision 5 and strike the second sentence. Is that right? Okay. Okay,
Your decision can be based on thought.
subsection B. An individual, corporation, or other entity shall not offer or provide mental health services through AI without the involvement of a mental health professional.
My question about this one is, is this the right place for that?
as opposed to,
over every, overarching. Overarching, I think.
this is really,
Let's get stupid.
this is in some ways the only thing that this section does. You have all the definitions and penalties to enforce this piece. There's also the D with the, official language, so I don't wanna minimize that, but
Okay, I get it. It's probably, it's okay to have it. I see, I was putting it before the definitions. You can't do that. It makes sense.
I mean, it's your bill, but.
But
My question is, wondering,
I was just gonna raise it
I'm
up.
getting there. That was my next question.
I don't think it's okay, somehow financially tied into this, and therefore uncover. I don't think that's what our intent is. I think the law, that this law or oversight or supervision or something.
Review.
Yeah.
Or
Yeah.
strong,
Okay, that'd be very strong.
yeah,
I think you're right.
Supervision.
Oversight.
well, it's
Just say without a mental health professional. Don't have to have it involved, but just without a mental professional, what is that?
I suppose you could do it that way. I guess I think, you have to tell me what your intent is, but I think what you're trying to get at is you want, the work product of the AI to be looked at and like assumed responsibility for. So it's not just, it's sort of two pieces in my mind. Like, one, you have to check it over, and two, you have to assume responsibility for what you've seen.
when you go back to what the coming thing was talking about just we're proposing somebody to put something up on a website. There's no oversight or supervision of what's happening. It's all about what you hit on.
Oh, and I'm not saying this would ever happen, but you could imagine that, a health professional. And this is a bizarre extreme case, but they could say, you know, use this app. And get back to me in a month. It's just, you don't really want that either.
Right, want direct connection.
So you could say there'll be threats against all of this. That's not-
Correct? And it's a dating involvement or something like that, a regular involvement. Feel like, well,
No, I think it works.
okay.
Doesn't say financial involved.
Involvement is fun, it's very broad. If that is your goal, then that word works. If you're trying to indicate the degree to what that involvement might look like, is it, you know, I typed it into AI and here it is, I was involved because I was the person inputting the parameters. And that,
I think if you make it clear that the professional is responsible
I don't think it was that.
legally responsible. As, you know, if they're legally responsible for their practice, for what they do with their clients. If they use AI in that process, I would assume their license and their legal responsibility. They're legally responsible for the outcome.
This just takes, I think this is pretty broad involvement,
Yeah,
and I think what he's trying to do is just taking that up a little bit. They're absolutely sure that they are.
So,
Not regular contact with
but what about,
mental health issues.
we've got all these great definitions that preceding our mental health, or, go ahead.
Jessup Arnold, Vermont Medical Society, I'm just wondering if you could pull the language from the top of page 5, which is what's defining what mental health professionals can do. Which basically is saying using AI provided the mental health professional reviews and approves any therapeutic communication or therapeutic
That's
decision.
exactly where I was going.
So, oh, sorry, not to take
No,
words
that's
out of your
great.
mouth, but because that seems to be what you're getting at, and
Yeah. Provided that the mental health professional reviews, approves a therapeutic communication or therapeutic decision. Because then it integrates the definitions that we had previously. It says exactly what the involvement is.
Back.
And without the involvement,
Drug administration, you know, it's just.
somehow
like without the review. and
include
approval by-
without the involvement. Provided.
So could you, instead of involvement, without the review and approval of the mental health professional?
Yeah, something like that. Let's try that, see how it is. Go. Yeah, so much for. Don't want to know. I don't want it. No, no. I never do it in 2001 space size.
There you go.
Yeah, it's new film. So what do we have, Katie?
Okay, so now you have. If the unit have an individual corporation or other entity shall not offer or provide mental health services through AI without the review and approval of a mental health professional.
So that needs to be more fleshed. Well, I'm wondering that they pull also of any therapeutic communication or therapeutic decision.
Yeah,
Yeah.
I think so.
Well, we're talking about mental health services.
Say it again. Help us again. Say it again.
I mean, mental health services includes therapeutic decision and communication. And I feel like adding that feels like it starts muddying the water for me, that you only need review and approval for certain aspects of mental health services.
Yeah, got it. Yeah. So say what you said again, please.
An individual, corporation, or other entity shall not offer or provide mental health services through AI without the approval, review and approval of a mental health professional.
So.
Instead of involvement, taking out involvement.
Yeah.
That's specific. What's wrong with that? Anything wrong with that? Okay, let's put that in.
Okay.
And then you'll hear. Here's some improvement.
Then you have, the violation. The violation of this section shall be deemed a violation of the Consumer Protection Act. The AG has the same authority to make rules, conduct civil investigations, and enter into assurances of discontinuance and bring civil actions. And private parties have the same rights and remedies as provided under 9 VSA 63(1). So I will make the same strike through that the AG requested and the identical language. And then a policy question for you is the inclusion of this civil penalty. Each violation of this section shall carry a civil penalty of 10,000 as set forth in 9 VSA.
So where would the strike through begin after authority?
The same authority, yeah, it would start there,
And that strikes it all the way over.
to and private parties. That's where it would pick up again.
I don't expect you to have the answer to this question, but I'm assuming that the mental health professional code of ethics is dealing with the graph of AI. Right?
I wonder,
We should find that out. I am
we should
curious.
ask them to do it in this thing.
Yeah, because we're assuming that they,
Why don't we ask them to do that?
assuming that they're dealing with it.
Professional regulation.
That's like a good enough.
Go ahead.
Joseph Barnard, Vermont Medical Society, not a comment on the code of ethics specifically, but on the violations
Sure.
section, if I may. So the social workers had an earlier version, that we would support the approach of differentiating between, companies and unlicensed entities violating these provisions versus a licensed professional. So that if you've got the chatbot run by an AI company, that's a CPA violation that's enforced that way. But you could have an instance, because we're talking about all these examples of using decision support tools where a mental health professional does make a mistake and uses something without approving it, that those would be an unprofessional conduct violation and
Yeah.
be pursued and go through all the OPR, Board of Medical Practice, unprofessional conduct route rather than the consumer protections violation route. So if you would be open to that consideration, I think Gail has language to bifurcate the penalty.
Can we do that, King?
My concern is that we, get into Title 26. And that we just removed that whole section that regulates, so it wouldn't be tied to anything. I guess I'm just wondering if you could do it in subsection C. Saying something like a violation of this section by a corporation or other entity or unlicensed mental health professional, and then be silent, unlicensed, and assume that section 2 will pick it up.
Well, that's what I was gonna say, section 2 addresses. Well,
And it's
right, maybe you don't even need to say it because it's there for the license.
But it wouldn't, if their professions regulated by the Board of Medical Practice,
Yeah.
that would pick that up though, right?
Or OPR?
Well, it would pick up the OPR in section 2.
Yeah, that's section 2.
This year, this.
Oh, sorry.
This is, you could say.
It does look like the American Psychological Association said they have updated the code of ethics to include AI. So the standards emphasize that while AI can be used to improve accessibility and administrative efficiency, it cannot replace the human therapeutic guidance, clinical judgment, or the ultimate responsibility of the professional compliant care. That is helpful. That's good to know.
Good for it.
Thank you.
So now going back to the oversight of violations.
So,
I'm happy to talk to Katie offline if that's.
Why don't we do that so we can look at something instead of trying to smooth that out here? So it does run into a couple of different things. Let's do that. Katie's out.
yeah, I'm just making your note for myself.
Make it easier.
So then you have this, subdivision that nothing in this section shall be construed to include or supplant any other statutory or common law remedies. Subdivision, subsection D. Nothing in this section shall preclude a mental health professional who is operating within their professional scope of practice from utilizing, oh gosh. Did everything this top of the. Sorry.
No, you kind of talk about it.
I have one more.
It wants to finance and no, I. Yeah. It's sugar free.
What's the problem? Sure.
My computer started showing lots of other pages. And I thought they were popping up on the screen, but they're not, so that worked out well. Okay, so nothing in this section shall preclude a mental health professional who is operating within the professional scope of practice from utilizing AI tools that are compliant with HIPAA or authorized by the US FDA, provided that the mental health professional reviews and approves any therapeutic communication or therapeutic decision. So since we were last talking about this sounds like DMS has information that the FDA does approve some AI tools. I wonder if HIPAA has to apply to both, if it's an or. The tools have to be HIPAA compliant. Well, I don't know that all of them are, that's what I was thinking, but I don't know if all of them are FDA approved. So I'm wondering if they're either HIPAA compliant or HIPAA compliant and FDA approved. I don't know enough about it to be able to make a recommendation on that.
Well, if they're FDA approved, it must be compliant. True or false?
Wondering if you have somebody who that's about to
So Joseph Barnard with the Medical Society, I believe all FDA approved AI tools, which would be things like in medical device software, would be HIPAA compliant, but not all HIPAA compliant AI tools are FDA reviewed or approved, if that makes sense. So like AI scribe technology does not get reviewed by the FDA. Some, if it's a part of a medical device software, then I believe it does go through that pathway. So did that answer so I think I think it would need to be the or, not and, because though
they're all HIPAA compliant.
I believe they would be still have to be used in a HIPAA compliant manner, I believe. I don't for sure know the answer to that right now.
So could we just say HIPAA and remove reference to FDA?
I think so. I could.
I don't want it to be HIPAA compliant,
Right.
period.
So why don't I flag that and maybe I could hear back if we could remove the FDA piece? Okay. We do. Okay.
I apologize. Yeah. For anything else, where are we?
So we just went through this last subsection D, and it sounds like your stakeholders will get back to me on whether we can just eliminate reference to FDA if everything would be covered under HIPAA and not need the two references.
Okay.
And then I have to ask, and I hope I don't open up a Pandora's box here. So is the term therapeutic communication and therapeutic decision correct on page 5, page 5, line 4? Or should that be mental health services, which is inclusive?
Right. I think mental health
Because up
service.
above, we do say individuals have to review and approve mental health services, not just decisions and communications.
I'm gonna suggest that we close out this conversation because we've got some folks waiting to testify from AOE. But maybe we could wordsmith that one. I
Okay.
like mental health services, but I will listen to the professionals in that one.
Okay, I will make the change for now, and if it doesn't, if there's feedback, then we can change it. Okay,
So the next time we look at this bill, we'll have an eye to final markup and possible vote.
There's a lot of changes.
It's a lot of good work. Thank you, Katie. You're welcome. It's a tough bill, but I think we're getting a good place.
yeah, you're welcome.
But I think AOE is out.
Yeah, I saw a Joe, I think better.
Thank you both. That might be some service. But I didn't want to miss that.
Yeah.
Sorry.
No. Yeah, it's there.
Yeah.
We'll be just doing all more, don't say that.
Are they coming in?
Yeah, they're coming. Making their way. Are they commenting on it earlier?
I don't know.
We don't know.
Budget discussion.
Budget.
Maybe we could close the door.
Yeah, Joe.
I don't know where they are.
Timing is
We're ending.
How's that?
Wow.
How's that?
We just said budget discussion and you walked in the door.
Roll.
Richie, would you mind telling them that we're quitting in 10 minutes if they must?
I made the mistake of saying whenever you're ready, I guess that
No,
wasn't.
we're ready.
Here they are.
We're good. Okay,
All right. Good morning.
good morning.
So we have 10 minutes. And I know
We'll
that
be efficient.
we asked you asked to come in and we're happy to have you in. When you all three want to sit together.
Why don't I'll do a very quick introduction and then I'm going to actually have Katie Smith come in.
Okay.
So,
But we don't know what it is that we're.
yeah, absolutely. So, should I jump in under the lines? Go for it.
Go for it.
Okay, so for the record, Jill Briggs Campbell, Deputy Secretary of Education and Chief of Operations. We appreciate the opportunity to come in today to speak about some language that was in this original proposal. You know, we're transferring the school-based Medicaid program from the Agency of Education, its administration over to Agency of Human Services. However, there was a really important piece of the work that still remained with the Agency of Education. And that was in the original proposed language. It was cut out without sort of opportunity to provide a testimony. And there's some kind of implications and consequences for that removal. So Katie Smith will come up in just a moment. She is our, she has a lot of experience in school-based Medicaid, but she's our new Director of Special Education Finance. And so she'll kind of tell you about what the language said, why it's important to have in there, and our specific request. Understand that we're under the gun. Yeah.
Thank
I
you.
have to read.
Okay, I get it. So, and what we're talking about is line of that is omitted in the budget.
Yes.
Got it, okay.
We've got the exact language. It existed in the original. Hi, for the record, I'm Katie Smith, Special Education Finance Director. For the last year, I was the Medicaid Director for the Agency of Education, so I've been working on this. Current state for what the statute requires is right now, there's a requirement for school districts to reinvest the revenue from the school-based Medicaid program into prevention and intervention programs. These are programs that serve all students regardless of disability status or health insurance. Some examples are the SNAPS Act program at Slate Valley. There's funding of positions like school nurses or staff that provide mental health and behavior supports, programs that address attendance and connect social work services to students and families. That leads into rulemaking authority why we're asking for this. So school districts have been asking the Agency of Education for guidance on how to use the funds, and we only have a few sentences in the statute to refer to give them guidance. Rulemaking would give us structure to collect better data on student supports. And we were really intentional with this request to strike some of the statute to balance it with rulemaking, so we can make sure nothing gaps and that additional details are clear to the field. And the consequences of if this language doesn't come back in, if we don't have rulemaking authority, the state produces data on spending that supports student success. We're tracking outcomes, goals that school districts have to meet student needs. It no longer links the funds to meeting the district quality standards, which is a whole series of education. It breaks the fiscal processes that we have in place for state-based student payments. There's a connection in there that was linked to the claims-based data, but now we're moving to processes. So that rulemaking really allows us to address the methodology for capturing these costs and prevent duplicative payments to school districts. And the last consequence is that we backtrack 30 years of national leadership in this field and reinvestment in essential wraparound supports for all students.
Thank you for that. So the language that was taken out is it a simple matter of having the language put back into the budget? So can I get a copy of that?
Yeah.
And then the committee will look at it. I'll share it with this committee as well. Just that, and then we'll also be talking with joint fiscal about any budgetary implications for that. So that as the conference committee goes on, they understand.
So we don't have this bill or anything like that. You're gonna take
No.
this to appropriations.
This is an appropriation.
Right, so
But honestly, we did have a bill in here. There was a bill to transfer all Medicaid expenditures from AOE into Diva so that it was all consolidated in place. And there's still some decision making left at ALE around this in your area, especially at other areas, in nursing. From the health prevention and intervention, those with students. So it would be helpful to see that language.
And I think that there's a little bit of a misunderstanding. So AHS will have rulemaking around the actual administration of the program. And then AOE retains a small portion of rulemaking that it points to the things that Katie was just speaking to. So we really are doing that split of roles and responsibilities. But the consequence here, I mean, if we're sort of speaking plainly about it, is that if we don't have requirements around these reinvestment funds, the way that it's going to be used, we just have to be very practical and clear-eyed about this, is that it will be used to reduce the property tax rate. Because that is what a business manager should do if they get sort of this extra dollars.
Understood.
And so it does unhook from really the intent and purpose of these funds. And it's something that they currently do, but not necessarily to greatest effect and without our authority to have the quality, like education and district quality standards around it.
Okay. All right, is there anything else that we need to?
Simple.
Oh, it's
Simple
always
request.
sounds so- Yeah. All
So
right.
you've got that language. We'll ensure that you
Please,
have it.
please send the language along and, I think copy L and as well as Callista.
Okay.
So that we have. Okay, all right,
We can do
and
that.
I've got 5 minutes and I'll let you want to offer any comments.
All I want with this book is the record. I think, what helps is to understand the background a little bit more. What happens is that schools provide services in the schools for Medicaid students. What the state is able to do is say, oh, we can draw a match on that service. It's sort of called the certified match. So what the state's doing is saying, well, if schools are already provide that service, they've already spent the money on it. So we as the state are saying, well, it's Medicaid eligible, so we're going to certify that and draw a federal match on that. Then what we're doing is we're giving the schools back some of that money, not all of it, but some of that money that draw the federal match. And what the AOE is saying, they want to use that money for quality-based, whatever their purposes. And the deputy secretary's point, if they don't do that, then business manager will just say, great, we've already spent this money. We just want to use that money to reimburse us back, and we could either use it for whatever we want or bring down the property rate. And what AOE is saying, we'd like to take that money and use it to incentivize,
Help and learning are inseparable.
So it's a policy decision. Like, do you think that the money AOE should be able to tell that they should be able to use that money for incentives, or should the business manager be able to decide for themselves how the money? That's the underlying decision policy. So if that makes it easier to understand.
No, I understand it, but it's not as simple as.
Ever simple.
Yeah, not
Always
simple,
more complicated.
but there's some context that I just thought was helpful.
Thank you.
That.
So what would be helpful is to understand how the money is currently being used and what your request is regarding future use of the money, because that sounds like that's part of the use of this. And you don't want to deprive the work that's going on. It's where the decision is made, I think. If it's made by a principal office.
Yeah, I mean, I think,
Pay fiscal.
yeah, I think, it wouldn't surprise you to learn that there is wide variability in how the funds are currently spent,
So
right? Yeah.
That sounds
Shocking, right? And, part of our reason for making this policy a choice when we were looking at moving the program over is, part of the sort of constant need that is being expressed by school districts is that they have growing costs associated with supporting student mental health, wellness, and well-being. This is a significant amount of funds that could be appropriately directed to what's a pretty broad bucket there. But being very clear about that. And that's sort of the intention of these funds is intervention and prevention. So that was the impetus behind doing it. And there is a balance between sort of giving districts more flexibility versus having a broad bucket of kind of uses, but sort of aligning them with both a clearly defined need that districts have, and it also gives superintendents, school boards, and business managers the ability to say, oh, we can't just use these funds for anything. We do actually have some guardrails. And having that clarity actually is supportive of their budgeting processes and communication with our public. So we're responding to something else that we're hearing from business managers as well. Whenever we can sort of offer them some clarity and guardrails, they tend to appreciate that, because then it doesn't put them on the front line of very challenging budgetary conversations.
Thank you. So what would be very helpful is to get some of this in writing, and we'll put it up as testimony on our web page, and then we'll have it as we make decisions. Absolutely.
I think
Really?
we sent that over.
Can you?
There was a written testimony.
Yeah, written
Are you
testimony.
wanting more details to that?
I'm sorry.
Are you wanting more details to that?
We already have your testimony, and I haven't looked at it, so I will look at it.
Thank you.
But any of the background information is fine. Will be helpful. Appreciate it.
Yes, that's good. And for context, so there's about $15 million of unspent funds currently. The whole program has been steady around $30 million in federal funding, but with this new change to a different payment model, there's a potential to have even more funds. We're going to see how this year plays out, but right now there's outstanding about $15 million, and they're asking us what is the best way to spend these funds, and we just don't have detailed information to give them. And it will still be in their hands to really design those prevention and intervention programs. It's still up to them. It's just setting those parameters and kind of framework for it.
Understood. Okay. Don't tell us that we got $50 million.
I mean,
Be careful.
Yeah,
One
it's
fund.
not ours. It's not ours.
Don't
It's
say
there,
it.
yeah.
Uh,
But I
Thanks
think
for that.
actually it's indicative of the fact that it's not being managed.
Okay. Oh, okay. I'm so sorry.
But I think that's a clear indication that it's not being managed, right? And
Yes,
the fact
understood.
that they would leave a penny on the table is,
Understood.
yeah.
Yeah, we don't. Okay. Thank you.
Thank you very much.
Elucidating. It's good to meet you.
Very nice to
And
meet you.
you had one, you.
All right.
All right, so we are gonna call it a wrap for the day.
We promise to be efficient.